Welcome, everyone. Thank you for joining us for the next installment of NUL's Health Equity webinar series. Today, the topic is racially conscious trauma-informed mental health care. My name is Lillian Mehran. I am a health equity scholar in residence at the National Urban League. I'm filling in as moderator for today. Before moving forward, I just want to go over some logistics. So our presenter will be answering questions at the end of her presentation, but we don't want you to forget them as they come up, so feel free to enter your questions in the Q&A box at any time. We are recording the presentation and we'll be sharing the recording with you once it's available. So without further ado, it's my pleasure to introduce our presenter for today, Dr. Eleanor Gil-Kashiwabara. Dr. Eleanor Gil-Kashiwabara is a licensed psychologist practicing in Portland, Oregon. Her training and professional experience is focused on children, adolescents, young adults, and families experiencing a variety of issues, including but not limited to trauma, including intergenerational trauma, historical loss, and racial trauma. Early childhood attachment disorders, maltreatment, neurodevelopment disorders, and mood disorders. She does it all. As a bilingual Latinx psychologist of Puerto Rican and Cuban descent, she is passionate about and committed to providing culturally responsive services to all clients, while emphasizing and addressing the service inequalities and culturally specific service provision in Latinx, American Indian, Alaska Native, and African American communities. Because of her extensive work history related to cultural responsiveness with culturally and linguistically diverse groups, she's established herself as a professional leader in her field at both the national and local levels. As an associate professor at Portland State University for 15 years, she served as the principal investigator for many federally funded grant programs addressing the development and implementation of culturally specific mental health programs for tribal and Latinx children and families using a community-based participatory model. 2 years ago, she transitioned to self-employment to fulfill a lifelong wish to open a private practice to provide culturally responsive therapeutic services, as well as organizational consulting and training to address equity issues within mental health services and other agencies. She's now the founder and president of Luminosa Psychological Services, LLC. We are so excited to have you here. We're looking forward to your presentation. And so I don't want to take up any more of your time. Thank you so much for joining us, Dr. Gil-Kashiwabara. I turn it over to you.
Thank you so much, Lillian. I just want to make sure everyone can hear me, or you can hear me. Okay, perfect. Thank you so much. It's an honor to be here. And I'm excited to be part of this webinar series. And as you can see from my slide, the title of my presentation today is Racially Conscious Trauma-Informed Mental Health Care. And I have a lot to cover today. So I'm going to jump right in and just get started. And I'm trying to move my slides. Let me see. I'm not sure why. Let's see, is there a trick to the slides? Oh, here it is. Sorry, I wasn't seeing the cursor there. Okay, so I want to start with an acknowledgement of the land and of the original people of the land. This is a picture I took myself close to my office on a walk break. This is the Willamette River in Portland, Oregon, where I'm currently based. And this is the Willamette River now. But I speak to you from this land that we now call Portland, Oregon, and Multnomah County, were the traditional lands of the Multnomah, Kathlamet, Clackamas, Tumwater, Tualatin, Kalapuya, Wasco, Molalla, Cowlitz, and Watlala bands of the Chinook, and many other tribes who made their home along the Willamette and Columbia rivers. Today, people from these bands have become part of the Confederated Tribes of the Grand Ronde, the Confederated Tribes of Siletz Indians, as well as the Chinook Nation and Cowlitz Nation in Washington State, just north of Oregon State. Today, I would like to pay respect to the elders, both past and present, who have stewarded the land throughout the generations. We honor the tribes and people impacted by practices of genocide and colonization. And so I just wanted to take a moment to do that and hope that everyone can take a moment from wherever you are at this time to just make that acknowledgement. And it's so important. I know that the practice of land acknowledgement hasn't been practiced by all for many, many years. And, it's just become more of a thing that has been done in more recent years by the broader population, though for tribal communities, that has always been part of the practice in opening gatherings of any sort. But what I wanted to just acknowledge is that by doing a land acknowledgement, by acknowledging the original stewards of the land, that is an example of how we incorporate healing toward BIPOC communities, in this case, the native people of the land, the first people. And it is really important to acknowledge, because the first step in healing, any kind of trauma that is historically rooted, or really any kind of trauma, but in this case, we're going to be talking about a lot about historical and racial trauma in terms of our consciousness around mental health. And so one of the first things we need to do to heal trauma is to acknowledge that trauma occurred, that something happened that was harmful. And that's the very first step in any kind of trauma-informed approach, is the acknowledgement and stating, yes, like this happened, and there's a recognition and awareness. And then, obviously you pair it with action, but that's the first step. And so that's why it's so important to do a land acknowledgement before we gather and before we work together. And so, true to my my Latin background and some indigenous roots as well, I am a storyteller. So I want to kick us off with a brief story. I'll try to keep it brief, but it's just a nice way to ease into this content. But essentially, I'm going to age myself a little bit. 20 years ago, when I was in my doctoral program in clinical psychology, I sat in my class that was titled Cross-Cultural Psychology. It was the only class in my doctoral program that required study of culture as it pertained to working with clients as a psychologist. And it was also, it was only the class required or not that pertained to this topic. This was a required class, but again, it was the only class. At the time, I was the only student of any minoritized background in my program. And on this particular day, the professor posed a question to the whole class. Should this paper that was required in this class be turned into an optional paper? Because many of the students in the class were in their last year of the program. They were about to go out to their internship, which is essentially like a residency right before, being an independent psychologist. It was a very rigorous process, and people were burned out. And did we really want to require a class at this point in people's training? I found myself sitting in the class, and as my colleague students were chiming in that, yeah, they really felt like it should be optional because, all of the reasons that they felt this, I found my face getting hot and flushed. My heart was beating really quickly because I knew that I had to, I just, there were a lot of feelings, right? It was a lot to take in, because here I was thinking, gosh, there are so many people who need services that are from communities that are underrepresented, and there are not enough psychologists and mental health professionals of color, but these professionals don't want to take the time to write a single paper about what it might be like to sit across from someone who doesn't have the same representation in the provider group. So I sat there and had all of my activated, essentially trauma response, like the heart beating fast, the face getting flushed, feeling sweaty. And I raised my hand and I basically expressed my concern, kind of the things I just shared with you. And I said, I hope that if you're not willing to write a paper about what it might be like as a psychologist to utilize culturally responsive approaches in your work, that when someone comes into your office who is of a different cultural or linguistic background, that you are willing to find somebody who can serve them appropriately, and that you're willing to refer that person to a provider who's willing to to do the work to understand what it means to be culturally responsive. After the class, I had several classmates come to me to thank me, that they were so grateful for my perspective that I brought into the program. But meanwhile, I probably shaved some days off of my life because of my cortisol response that was elevated. We have a lot of research to show that the ongoing experience of just elevated cortisol is harmful to people of color, and because of the constant state of that being ready to run away, being ready to fight, flight, or freeze, which is like the words that are used to talk about trauma. So I guess what I want to say is that there's a lot of ways that trauma can show up. There is trauma where there's like a very traumatic single incident. That is a trauma. And then there's the ongoing trauma because of experiences of discrimination. And depending on all of the intersections of your identity, it can get compounded. So I share that story because it's just a snapshot, and it's not even, it's interesting because some people might say, well, that's not such a big deal. So you had to defend the need for a paper in your doctoral program. But I think what is the big deal is like positions that many students of color, for example, get put into, where they are the only person to educate their peers and their instructors about these issues, or just having their experience minimized. Like, to me, it felt like an assault to not only my Latinx community, but other BIPOC communities that I was passionate about serving, that that it didn't matter to try to understand how to provide services in a better way. So, these kinds of experiences can build and can really cause harm, health-wise as well as mental health-wise. So I share that anecdotally, but also share that it's not an isolated incident, and there's a lot of ways in which there are, I don't like to say things are worse or not. I'll get into that soon, but there's just many ways that these things show up for people on a day-to-day basis. So briefly, I won't spend a lot of time here, but I would like to give some kind of a roadmap. We will, I'll give examples throughout, but we'll talk a lot about definitions and areas of grounding. The definitions, you might feel like, oh, really, definitions, but all of these definitions basically paint a picture and tell the story about what, and kind of build up to what is meant by trauma-informed care, what is meant by being racially conscious. I'll give an example of just the field of psychology, how there is work being done currently to what is called decolonized psychology. And I'll also give some considerations. I am coming at this information as a psychologist. However, I really truly believe that the information that I'm sharing with you is relevant to many fields that are working with communities, and in the different ways that you're working, other mental health providers as well as health providers, and people that are working and serving communities in many different ways through agency work. I just want to like make clear that even though I'm coming at this information as a psychologist, I really feel it's deeply relevant across the board to many professions and intersection of community work. Okay, so I first want to define trauma before we do anything else, the trauma generally. So basically, you might be surprised to know there is not really a universal definition of trauma. And there's a reason for that. The SAMHSA, which is the federal agency acronym for the Substance Abuse and Mental Health Services Administration. So they kind of deal a lot with the mental health space in terms of federal services and funding. But their definition of trauma is an event. Sorry, I'm trying to move. I can see my slide a little better. Their direct definition is an event, a series of events or set of circumstances experienced by an individual as physically or emotional harmful or life-threatening with lasting adverse effects on the individual's functioning and mental, physical, social, emotional, or spiritual well-being. So this is a pretty broad definition, but essentially is saying that you can have a circumstance, like a situation, like a single event, and that's, you know, maybe if you've been in a violent situation or been attacked, you know, just all of a sudden out of nowhere, you know, there's, you know, specific violent events or other traumatic events, but then there's these ongoing circumstances that can create trauma as well, which is the experience of discrimination, the experience of racism or other isms. So I just want to be clear that it can be a specific or ongoing. And it's important to know when you think about trauma, like what the trauma is, you know, that you might be engaging with, because it really does maybe help you to think a little bit differently about how you might engage with someone or with a situation, or how you might try to understand a person or an organization or a context. But also the reason why there isn't a universal definition, or it's kind of hard, or it has been hard to define trauma, is because the experience of trauma is subjective. It's really individual based on that person's perception. So I'm sure everyone may have had an experience here where you think, gosh, that person is having such a strong reaction to that. I'm not sure why. I mean, maybe you don't mean that to be minimizing, but you're like, I feel like they're making a really big deal about that. Some of us have been in that situation, but the thing is, perhaps for that person, there is an association that's really traumatic, or that is really connecting them to a deep emotional reaction or response, versus someone who maybe doesn't have that connection. So there can be a subjective element to trauma in terms of what are the things that make some people, even in the space of being discriminated against, some people may be more sensitive to certain discriminations than others based on their own history, and the things that have happened to them. So I think it's important to understand that trauma can be subjective. And also one more point is that the impact of these adverse events, especially in childhood, can be very deep and far reaching and go and follow us through life. And they can also be associated with being compromised, having compromised health later in life. So, you know, the earlier some things happen, or if it's like lifelong and you have memories from early childhood, that can also have a significant impact. Okay, so I want to mention, I'm kind of going to be zipping through some of these definitions, but it's not because they're not important. In the reference list, there's a handout that will be circulated if it hasn't been already. There is a list of videos in that handout, and I highly recommend watching the 3 videos that address historical trauma. They're each about 10 minutes long, maybe more or less, and they're fabulous. So if we had a lot of time, I would show them and we would discuss them. But essentially, what I want you to know about historical trauma is that it essentially refers to experiences such as, but not limited to, genocide and slavery, forced relocation, destruction of cultural practices that are shared by communities. And these experiences can result in a cumulative emotional and psychological impact that gets carried across generations because of those disruptions. And you know, it's hard to recover within one generation from those disruptions that happen in the family as well. So as a result, like I just said, many people in these same communities experience higher rates of mental and physical illness and substance abuse and family erosion experience, and community structures. And so these kinds of persistent, ongoing, intergenerational traumas that are historically rooted can really impact the vibrancy of a culture. I mean, we hear about things like language, loss of language in Native communities is one example of many that are a result of historical trauma. For some reason, I can't always get my cursor, but okay. Okay, so racial trauma is also referred to as race-based traumatic stress. And this refers to the mental and emotional injury that's caused by encounters with racial bias and ethnic discrimination, racism, and hate crimes. It can include threats of harm, having humiliating and shaming events or witnessing harm to others of specific communities or groups that you belong to. And it stems from a legacy of oppressive laws, policies, and practices, which is also known as, systemic racism. So that legacy of oppressive laws and policies is what we refer to as systemic racism. It's very strange for me to just be talking at everyone with the webinar. So thanks for your patience. And we'll hopefully, we'll get to questions after. Also, I just want to make a note of intersectionality, which was coined by Crenshaw in 1993, but it really just is the overlap of social group categorizations that include but are not limited to race and gender and social class. So, for example, I am a Latina woman. I have a hidden disability, but it is a disability. I'm deaf in one ear. So I have the intersection of culture as a woman, gender, and as having a disability, so that's those are intersections. And these intersections can be, more impactful or less depending. So I have a privilege in having a hidden disability because it's not visible. So I also, as a Latina with, lighter skin, have a privilege in skin color. And so, there are all these intersections, and that depending on where you are with those intersections and identity categories, you can have more or less privilege. So those are just important things to kind of think about. And so, yeah, we'll go from here. And everyone, maybe, I think many, I know that it's becoming much more in the lingo of everyday life, but I just want to make a comment about microaggressions, which are more widely used than it has been before. It was more in the academic literature before, but now I think it's kind of making its way into everyday conversation. But microaggressions have become widely acknowledged as a form of racial trauma and race-based stress. Actually, and as a reminder, a lot of folks don't know that there are different types of microaggressions. So micro assaults are blatant racial discrimination. Micro insults are racial insensitivity related to ethnic background or heritage. And micro invalidations are just denial of racialized experiences faced by ethnic and racial minorities. So when people are like, no, that's just in your head, I don't really think that that's what was happening. If you might say, I think that maybe somebody was discriminating against me or thinking I wasn't very smart because they heard my accent or they made a judgment about me. And then somebody else says, no, I don't think so. I think you're totally misconstruing that. And so, just invalidating someone's experience or what they're expressing as having experienced. That's probably the most common one, is the micro invalidation. Those can be really hurtful because they're cumulative and they're very covert, which means that they're hidden. And so a lot of times you just kind of push them away, but that doesn't mean that they go away, right? So it's just kind of compartmentalized in a box, but it kind of can sit in your heart and build up. So I also just want to talk about what a trauma-informed approach is. So anyway, what I'm doing here is giving you these definitions because I know that this group, there's a lot of different folks. Some may be mental health providers and some may be providers in other agencies like transportation, or just intersecting with different communities and different types of service-related agencies. And so really what I do want to say is that even though some of these may seem like psychological concepts, when we interact with people, it really helps to understand that they may or may not, you don't necessarily want to assume or make an assumption of how people are carrying trauma, but it's important to understand that it exists, and that if you have an identity that is an identity that the system is not created to support, that you're probably running into more discrimination, and it may be difficult to deal with. And so really just understanding that you have to carry that in your mind really for all interactions. So just to kind of talk about what it means to have a trauma-informed approach. Again, I'm going back to SAMHSA because SAMHSA has really created probably the most definitions in this space, but it's really a program or an organization. So everyone thinking about, where you are in terms of where you're working, to be trauma-informed, it's, about being in a program or organization or system that realizes, so there's realizing the widespread impact of trauma. So that's kind of like that acknowledging that we did in the beginning with the land acknowledgement. You're realizing that there's an impact of trauma. You're understanding the potential paths for recovery. So you're understanding that, acknowledging that trauma is important. You're recognizing the signs and symptoms of trauma in clients, families, staff, and others involved with the system. So you're really understanding, like, there might be certain things that can show up for people that demonstrate maybe some experience that was traumatic. Responding, you respond by fully integrating knowledge about trauma into policies and procedures and practices, and seek to actively resist re-traumatization. So an organization that is trauma-informed is really working to resist, find ways to interrupt re-traumatizing the individuals that they serve because of the way that the work is being delivered or the services are being delivered. And so here are the 6 principles of trauma-informed approach. Those include safety. I'm so sorry, I think there's a construction truck on my street here, so I hope you can hear me. There are 6 principles, and those include safety, trustworthiness and transparency about what is happening, peer support, being collaborative, having mutual interaction, empowering each other, allowing for people to have voice, to have choice, and an integration of cultural and historical and gender issues. So that's kind of the overall umbrella for what a trauma-informed approach is, but I kind of want to zoom in. I'm trying to move my window here with the video, but what a racially conscious trauma-informed approach would add or bring to this is the acknowledgement and treatment of race-based stress and discrimination as trauma, acknowledging that those experiences fall into the umbrella of trauma, that ongoing day-to-day trauma. Really important, and this might be more like geared toward like psychological interventions, but again, I think it's really important for all interactions and working with people on the ground. It really requires a focus of both the internal symptoms of trauma, like understanding, okay, this person is having a lot of maybe reactivity or something, and that's might be more of an internal response, but also acknowledging that there are external factors. So really saying, making it clear that there's an understanding that there is a system which has created the barriers or some of the barriers and have contributed maybe to that internal response of trauma. So really understanding that there's internal and external components, and the external components are generally systemic and the cause of oppression. And also requiring a combination of treatment models, including a trauma-informed perspective, along with just maybe having a lens on systemic oppression. So again, like understanding as much as you can about systemic, about ways that the system re-traumatizes and recreates oppressive circumstances. And there are a lot of ways to learn about things like liberation. I mean, this is more like psychology, but again, I feel like it's applicable to many groups. Liberation psychology and just the approach of trying to decolonize systems. So I'm using a lot of like jargon and language, but I'll talk to you about what those terms mean now. So when I talk about decolonizing systems, first it's good to know what colonial is. Colonial refers to the pervasive, like society, in society and in politics, policies that try to have authority over marginalized communities, and also exploiting the earth, for example, for its natural resources by way of imposing oppressive and dominance, and imposing dominance over cultural practices. So it's really you hear a lot about like, oh, colonizers, like people who came in historically and imposed their ways on another community and oppress them and harm them. And so what then does it mean to decolonize? It means that you are engaging in a series of actions and behaviors that bring into question and disrupt the systems that are promoting inequity, promoting racism, whether the systems know it or not, and promoting oppression. And so decolonize basically is another way of saying interrupting oppression and interrupting systemic practices that are in place and harmful to treat people differently and harmful to some subpopulations. And I just want to make a mention of implicit bias, because this is individual and organizational. Communities, we all, every single person, no matter what your background is, every single agency, no matter what your community of focus is, no matter what, everyone has unconscious and unintentional bias against others. Those are based on your experience of being who you are in the world. So you are going to have a very specific set of biases, and you may have many unintentional biases. They are shaped from a very early age. That's why a lot of times you don't know that you have them, because they're almost automatic and it takes a lot of intentionality to undo them. So implicit biases affect everything. They affect our relationships, our interactions with others. So when we are working in an organization and we're serving others, it takes practice to stop yourself and say, wow, I had a story about this person. I had a story in my head and I was just surprised. So when you're surprised by something, that's because you maybe had an implicit bias. If you're surprised by something, it's because you thought it was going to be different, or that person was going to be different, or the path was going to be different. And so, like trying to, again, the decolonizing approach is when you try to question the things that you know to be. And so we all have them. And so it's just super important to be aware that to accept that we all have them, no matter how like amazing and open and so much work you've done, we all have implicit biases. And we can only know what we know, but we can certainly try to open ourselves up to know more and to take other perspectives. That's why writing the paper in that class was important. But we really only know what we know in our person. And so that's like one of the first steps. Implicit bias is a super important thing to understand that we all have, and it affects everything we do. It affects our work and it affects our personal relationships. Okay. So again, just regrounding us. So just a reminder that, here we're talking about um, just trauma-informed practices. And I want to drive home that point that it is because trauma-informed care, it's not just for after a trauma has occurred, like a specific trauma. It's recommended in all interactions because there are ongoing traumas and we all experience trauma in different capacities. And depending on our identities and the intersections of our identities, we may have just differing experiences and intensities of trauma. But it's important to understand that we should really think about all interactions and all engagements as, understanding that there needs to be that sensitivity. We don't know what any one person is bringing. We don't know, just by looking at someone, what their experience is. So that's another thing that happens a lot, and it's easy to do because of the pace of life, but a lot of times we don't realize what someone is bringing with them because there's an assumption that gets made right off the bat. So again, the importance of differentiating and understanding between levels of trauma, historical, intergenerational, racial. It's very important that we understand that there are variations in the expression of trauma and that we know that that's true. So, we just have to try to like learn what we can, especially if we're having a hard time, maybe connecting with someone in the work that we're doing. And I want to just also say something about resilience being redefined from a BIPOC lens. And the reason I talk about redefining resilience is because, the baseline definition of resilience is one's ability to cope and with and overcome hardships. And that is true. But I also want to propose a strength-based perspective as we talk about all of the hardships that are prevalent in a experience of daily racial trauma, that BIPOC are resilient in the face. And BIPOC just is me referring to youth of color. So it's like Black, Indigenous people of color and Black, Indigenous youth of color are resilient in the face of race-based stress, and they've developed coping strategies across the generations to heal from trauma. So not only is trauma potentially something that gets carried across generations, but so is healing, and so is coping, and so is like family strength. And so it's important to know that connecting to stories in the community is another way to connect to strength. Storytelling can be one way that communities build strength, connect with each other, and also that the stories are not only stories of hardship, but there are stories of joy while oppression is being experienced. And so it's just important to know that, it is a very complex process, the process of resilience for BIPOC people. It's not just bouncing back from a hardship, but it is about also celebrating joy in the midst of oppression that is daily and not avoidable often. And so one thing that is in the reference list that's in the handout, there are some articles. There's one that addresses the radical healing perspective. And that really is, this is like an oversimplistic description. It's a very rich, it's a very rich body of work, but really talks about, like recognizing that there is much joy in the lived experience and that things can coexist. You can be experiencing these things and you have other strengths and the opportunity to access joy. And so I think radical healing is an approach that is, talked a lot about in psychology and helping clients of color, but I think it can be relevant for many fields. Oh, I don't know what just happened. I just am going to skip around a little bit, but basically, I do want to say that because we live in a society where systemic racism is alive and well, the foundation of the profession of psychology and the foundation of many of the services that get provided, in the government context and even in community context are founded on racist beliefs and practices. And that's because, I won't read this whole thing, but that's because of systemic racism, which again are the policies and the procedures of institutions that promote circumstances for some communities and oppress circumstances for other communities. And so this cuts across all kinds of areas like housing, government, education, media, representation in the media. Do you see yourself on screen? Or how do you see yourself on screen? How are you represented? Business, healthcare, the criminal justice system, employment, etc. Like all of these systems perpetuate racism and uphold racism. And so we need to understand then that all of our professions, like medicine and psychology and education, all of our professions are kind of born out of this foundation. And so as a quick example, I'm rushing a little. I apologize because I want to have some time for questions. But as a quick example, I just want to give the example of how psychology is trying to decolonize the field. That is a huge task because its foundations are rooted in racism and the historical systemic practices. And so some of the things that they're doing, there's been a lot of work. There've been a lot of resolutions and writings, gathering of experts and communities to guide ultimately a racial equity plan. But one of the things that APA did was to create a resolution on harnessing psychology to combat racism. And so they did things such as adopting a uniform definition for all psychologists to agree on what is racism, especially as it applies to the work of psychologists, acknowledging that there's a historical context and a current context around racist practices in psychology, that it's systemic, that harm has been caused to communities of color, that the field of psychology has contributed to racial bias, and then really affirming the denunciation of racism in all forms. And what are we going to do to undo all of this? So this is like the acknowledgement stage. And then, continuing to say things like, as psychologists, we need to acknowledge that we have positionality. That means like, where do we sit in position to other people and the communities we serve, and where do we hold privilege and power? And how do we have awareness around that when we serve others? So this is something that everyone can take with them. Just continuing to advocate for services that are culturally informed, for research that really promotes resilience and that doesn't harm communities, to look at things from a strength-based lens and not a deficit base, because those deficits were created by a racist system. And so ultimately psychology gathered many folks from different backgrounds of expertise, including professionals of color, and came together with a racial equity think tank to inform their equity plan. And their equity plan, I linked to an article about it in the handout, but it has different areas that will be the focus of how to bring equity to the field. And this includes apologizing to BIPOC communities as a whole and to specific communities as well. And so that's just an example of all that it takes to decolonize one field. It's like you almost have to start over, but you have to start over while recognizing all the harm that's been done, and you have to then move forth and try to do better. So I skipped over another sort of group that created work in the decolonizing space for psychology, not because it's not important, but because of time. It's referenced in the reference list. It's an article called The Warrior's Path that also kind of can show you what decolonizing might look like. And so I just am kind of going to focus now on some, I'm going to try to wrap this so we have time for questions, but some key features that can be used in treatment or in your service work. So these include things I've already said, both recognizing internal circumstances that a person or a family or a community is dealing with, but also recognizing the external circumstances at the same time, recognizing the BIPOC perspective of resilience, supporting an intersectional stance, understanding that intersections matter, that intersections can build upon each other and create more or less adversity, or strength, or experiences can differ widely based on intersections. And it also is important to have that intersectional stance and understanding, at least, because it allows people of color, communities of color, individuals of color, families of color, to explore the sources of their difficulties and challenge assumptions, like challenge those external circumstances. It can take away, you know, sometimes when you have experiences of oppression, you can be very hard on yourself and self-blaming. But when you're looking at the internal and external factors, and you realize that additional intersections of identities that are minoritized can create more system blockage, you can externalize a little more and go, oh, okay, no wonder this is really hard, because these things are happening. These things are system pieces that are really difficult for anyone to overcome. And so it can help with depathologizing, and it can open dialogues that help clients and help providers to generate alternate accounts of what's happening, and maybe even alternate ways to work around to address solutions. So these are just some theories. These are more clinical. They're in your reference list, but radical healing, which I talked about, liberation, which really is like more of a collective social action lens, and that's also referenced in the reference list. And then relational cultural theory, which is it's a feminist theoretical lens that culture is really like the key connector in relationship, and it really is like rooted in both like a feminist lens and a social justice lens. So I encourage you to maybe like look at some of those perspectives. And I do think that other ways at the organization level to really start to walk a path and take a journey around being racially conscious and trauma informed is to really look at the implicit biases, not just of individuals. It's always important as an individual, but of your organization, and examine interpretive power. And by that is, it's not too different from implicit bias, but is, which is just like looking at, it could be something as simple as writing down all of your identities, where you hold privilege, where you hold less privilege and more privilege, and then where you have the ability to reach across to understand more. Sometimes we don't stop to ask ourselves, where do I need to learn more? Where do I need to expand and grow so that I can connect more with this person, or so that our agency can connect more? Really committing to anti-racist practices. What language are we using when we talk with each other in our organizations about our clients? Are we pathologizing our clients even if we're not aware of it? Are we using language such as this person is a medication seeker or whatever? You know, how are you charting this information? With providers of color, are you providing opportunities to supervise from a way that is culturally responsive, that acknowledges the provider's background as well? Are you encouraging self-care that really allows the provider to explore self-care that is also healing for themselves. How are we caring for our providers of color as well? We want to make sure we have representation in our workforce, continued training to support this model, and work on our policies. So, all of these do intersect with advocacy, especially at the policy level. So even creating policies in your organization, even about how do we address missteps? How do we really address them? Do we have a way in place to have conversations about these difficult things? Are we thinking about what this would look like? So I think the first step with advocacy is to create policy. I'll skip this because this is more community level. It's not that it's not important, but if you are doing community work, it's important to include community representatives and advisory committees, partnering with other agencies that are in the community, and intersecting with advocacy with other systems to eradicate racism. So like working together, because there's a lot of ways that you can do more working together, exploring what that might look like, even if it's not immediately obvious. I'm gonna skip this because I don't have time, but in your list is a book. I actually have it here. I was gonna read an excerpt from it, but it's called Burnout. And it really talks about unlocking the stress cycle. And I just think it's so useful for providers on the ground, but also for thinking about everyone that we work with. And it just talks about how stress is in our bodies and how do we unlock that that cycle. So I feel like I just sped through what is like 4 hours of content. So I'm sorry. I know that was a lot, but yeah.
Well, thank you so much. I mean, there you covered so many really important things. And yes, to everyone, we'll be emailing the handout to you after this. And so feel free to enter your questions in the Q&A. And one of the questions I had for you, unfortunately, mental health and mental health services still carry some stigma in our society. And I was wondering, it seems like when we're talking about trauma-informed care, recognizing, I appreciated you talk about depathologizing, recognizing that there are these systems of oppression that are contributing to these real health issues. And so when we're talking about, if we're going out in communities and talking about mental health services and the value of trauma-informed care, I'm wondering, is there any language that you found that's useful to really try to overcome this stigma when we're having these conversations in communities, especially around trauma-informed care? And if there are any resources that might be helpful there too.
Yeah, I think so. Again, in the handout, there is one link that's under the links that is linked to like Mental Health America, and it has like racial trauma. It's a racial trauma link, but in there's a lot of resources, including therapeutic. But I do think, first of all, I think creating spaces for discussion that like normalizes that like these are quote normal responses to a very messed up system. Like I mean that like really like externalizes, I think, is one of the ways that we can destigmatize. We have the added issue that for many communities of color, and especially like with different generations within those communities, there may be family stigma. So if you tend to work more with youth, the youth might be a little more open to the mental health care or opportunity, but maybe having barriers with a parent or a grandparent around what that means to access care. And so there sometimes is a lot of within community stigma. So I think that like the first thing is having conversations, like making it okay to talk about mental health, making it okay. And then sometimes one thing, like especially for communities that maybe yeah, it's hard, we have like data and and it's not intended to be over stereotypical, but some communities access mental health less and more than others, and so we have some data where yeah, it's like very hard to even say that something is a mental health issue. So sometimes I will talk more about symptoms. Do like, is your heart beating really fast? Do you feel a little nervous? Is it hard to focus on things? Like, so maybe talking about what's happening rather than labeling it, but you can still get at like asking about symptoms. And sometimes that's a way to be able to talk about it. And then, it's hard, but as providers, I think, whatever service you're in, you can kind of feel it out, and if the person is saying, you know, I feel nervous, I'm getting stuck. I find myself not able to say anything, like that would be like a freeze response if something's really hard, not being able to move or, feel motivated at all. Depending on what kind of provider you are, if you're not a mental health provider, you can say like, oh, we have someone here who, you can talk to, would you be open to talking to them? They're really someone who knows a lot about this kind of thing. But I think always starting with symptoms, especially if it's really hard to use the mental health term, that can be like an immediate destigmatizer because it's just talking about what's going on. And a lot of times it is physical, right? Like sometimes these things show up physically in your body, like the immediate response.
Mhm. Thank you. That's really helpful. And yes, feel free to enter your questions in the Q&A. Another question that came up for me, and so if we are collaborating with, let's say, a hospital system or other service agencies, now that we've heard about this, recognizing you brought up concerns about systems re-traumatizing folks because these systems were developed and rooted within racism. And so do you have any advice or insight, if we were speaking with, let's say, representatives for a local hospital or a social service agency, how to start to broach conversations about the need for trauma-informed care?
Yeah, that's a great question. I mean, I think that, yeah, so systemically, I mean, I think first of all, systems respond to data. And like, right, we know that like systems are always like, well, show me the data. Now that's not always available, but I think if sometimes you can have almost like the elevator speech of like three very compelling things about maybe if you're advocating for like a specific community that you're working with, that you are trying to have that community access services in the hospital or whatever, having like three very compelling pieces of data about the impact of not being able to have the appropriate type of service for them. I think sometimes some kind of data, even if you haven't personally had a study, but you can gather some kind of information, because I do think that like, and it's really hard because the flip side of that is that stories are very compelling. And so to the extent that you're not breaching confidentiality or whatever, not using a name that would be obvious or a circumstance that the provider would know. I think stories sometimes are even more compelling than data, but the combination of both. So I think like really approaching the system and really, systems are always in a rush and like it's hard. You want to make these inroads and almost force the system to take the time to hear you and to take the time that is needed to decolonize. But I think like starting kind of in that middle ground with like a story and some data and just like making that inroad. But even a story that reflects something harmful that the system did. So I know we're almost done, but I talked about a physician that I know who encountered a label in a client's chart as a medication seeker. And this was a Black woman who had a lot of trauma, but nobody had taken the time to talk to this patient in this case about their trauma. And this provider took the time over several months to make an intentional effort to get that label off that person's chart. So it's intentional hard work, but almost like if there's a circumstance that you know about where somebody has been harmed, like I think almost reflecting like back at a mirror and saying, this happened here. This is, it's hard to argue with that data sometimes. It's hard to argue with like looking in the mirror at something that the system directly did. So I think anywhere where you can reflect like data, a story, harm that was done, and like why that needs to change is a good start.
One question that came through, and then I know we're almost out of time.
Yeah.
A question came through: is there evidence that single gender sessions make a difference or are more impactful for any particular age group if there were programs that were group-based to help address some of these traumas and concerns?
So you mean like like gender matching? Is that what you said?
Yeah, so the question is regarding whether, I guess, if there are sessions or I'm interpreting this, tell me if I'm wrong, if there are, I think, group sessions, perhaps, is it helpful to try to have everyone have the same gender identity, or, does that tend to not really make a difference?
I don't have the data on that. I can try to find that out. However, what I will say, just my gut, like as a provider, is that this is not the answer I'm sure that you want, because it's not really a clear answer. But there is so much variation on age, like people are very young. Like if you're talking about very young kids, like there's stages where, there's less or more comfort with same gender circumstances. And it also depends on the type of trauma, right? Like if there's like a sexual trauma or another type of trauma. So I think I would say like, I don't have the data on that, but I think it would really depend on the circumstance. And then there's just some people that are very comfortable with mixed gender groups and some people that are not. And that again is such a personal experience. So I would say that maybe depending on the kind of intervention, depending on the type of intervention, you would want to consider the specific circumstance. I can try to find out more about that. It's a little hard without knowing like the exact type of trauma and everything in age group, but I can try to see if I don't have the updated data on that. I'm sorry, but I do think that there are probably variations and specificities depending on type of trauma and age.
Well, thank you so much. Before we wrap up, are there any final thoughts you would want to share? Anything, any ideas or resources? I know we're going to send out that handout, but just want to give you another moment to share any thoughts.
Yeah, I want to say that this didn't, that it's not a long time and there's so much here. And so I feel like it was like a lot of content to put forth, but I think, I don't know, Lillian, maybe you want to express a mechanism, like if anyone wants to send you questions and then you can send me and I can try to answer any questions. I would encourage people though, like at least the videos and like the links that I put in there, if not the reference list, to look at those videos, because I think it's really a great foundation for understanding the way historical trauma can show up and how deep rooted it can be. So I would encourage that as a starting point. And I think this is an evolving and ongoing space, as everyone here knows. It's evolving. Organizations are evolving for themselves, and then our system and our society is as well. So I think just kind of attending to all of the things as they keep coming up. There's a lot coming out every single day, every single month on this topic.
Well, yes, I will. So I'll send out the handout, and also feel free to reply, and I'm happy to connect us, and then we can get some for you if you have any questions that come up. So yes, so thank you so much, Dr. Gil-Kashiwabara. We really appreciate your taking the time to meet with us today to discuss this important topic, and we're so grateful for the information and insight that you shared. And to all of you joining us, thank you so much for spending some of your day learning with us, and I hope that everyone enjoys the rest of the day. Take care now.
Thank you, everyone.